Hi, welcome to this video. Glad you're watching. I love this topic because this is completely what I spend my time doing on the daily in the AutPlay clinic, working with neurodivergent children. And our topic today is 5 steps, just 5, for using play therapy with neurodivergent children. 5 fairly simple, but yet very important steps for us play therapists when we work with neurodivergent children. Step 1 should be no surprise to any play therapist, and that is relationship. Relationship development is the #1 important thing when we work with any child. And that means neurodivergent children too. We want to make sure that we are focusing on relationship development. And within that, what we are doing with the neurodivergent child is we are creating safety. We are decreasing anxiety and dysregulation that they will likely be coming into the play therapy session with. And we are helping them feel comfortable with us and feel comfortable in this space and feeling safe. And of course, developing that relationship with us that is full of so much therapeutic benefit. So that is the first thing, is that focus on relationship development. Second thing is making a very, very real effort to understand the neurodivergent child's play preferences and play interests. Kids will come in, neurodivergent kids will come in to see you with play preferences and interests, things that they like, they enjoy, types of play that mean something to them, that give them benefit as they participate in this type of play or this type of interest. And it may be something that you're not used to seeing. It could be something that you don't typically see in neurotypical children. And it's not our job to judge the play preference or interest. It's our job to recognize it, value it, and join the child in that play preference or interest that they have. So it's really important that you observe, you let the child show you their play preferences, you ask them, you have process in place where you definitely can learn, this child, this is the type of play that they like to do. This is their type of play. And I know that. And so I'm going to support that, and I'm going to join them in that type of play instead of trying to force them to do or learn another type of play, right? Third thing is therapy needs. Focusing on why are they here? Why are they here to see me? I think we have this problem historically and sometimes even currently where a neurodivergent child gets a diagnosis and suddenly it's like, okay, here, bam, go find these 5 therapies and put your child in them. And it's like, well, why are they going to that therapy and that therapy and that therapy? I mean, is there a real need there that type of therapy and that therapist could help with? So when a child comes in to see us, we need to really look at and assess and analyze, is there really a reason why they're here to see me and something that I can help them with? I mean, we're play therapists, we're mental health therapists. So is there a mental health need here that I can help with? Are they struggling with regulation issues, high anxiety, depression? Do they have trauma issues? Are they struggling with low self-esteem because of their identity needs? Okay, if there's a real need, absolutely we want them in play therapy and we want to be working with them and helping them. But we just need to be mindful that we need to see what that therapy need is, and it needs to be a real therapy need of the child. Number 4, give the child a voice. They have a voice, just allow them to use it in the therapy. What do they think? How are they feeling? What are they experiencing right now? What do they want help with or think they need help with? One of the biggest things we do in AutPlay therapy in our affirming constructs is giving the child a voice. They're a partner in the process. We want to hear from them all the time. We want them to contribute. And even if you're working with a child who is nonverbal, that's okay. Look for all the ways you can to make sure they have a way to communicate with you what's going on with them, how they think and feel about what they're experiencing in therapy, and what they want. We want them to be a part of it as much as possible. Again, historically, and unfortunately, sometimes still currently, that is not the case. They are completely devalued in terms of their say and their opinion in their own therapy process. And we do not want to be doing that as play therapists. Number 5, and the last one, is empowering identity. So this is so important because neurodivergence is an identity. So when you're working with neurodivergent kids, you want to make sure that they feel empowered and they feel positive and good about being neurodivergent. This isn't some bad thing, some less thing, something they need to try to eradicate because it's awful and they need to look like this and be this instead. We want them to be empowered in their identity. And so as we navigate through a play therapy intervention or a play therapy theory or whatever we're doing with the child, whatever needs we're working on, we always make sure that we stay empowering of their identity. So these 5 things are really great tips. Obviously, we could get into a lot more, and you can go into depth and dive a lot deeper in some of the trainings on the AutPlay therapy website. But these are really nice things to really get you started and to think about and make sure that you're following in your play therapy work with children. And they're all affirming. You know, these are affirming ideas, and bottom line, foundational. You know, when you're working with neurodivergent kids, you want to be working out of a neurodiversity informed and affirming space. And you know, these 5 tips I shared with you certainly are within that kind of affirming space. So if you're new to even to that idea, go learn more about, you know, the neurodiversity paradigm and the neurodiversity movement, because this is foundational information, you know, when we work with neurodivergent kids. And play therapy, or honestly, anybody who's watching this video, any therapy needs to be neurodiversity affirming as a base, as a foundation. So I hope you found this helpful. Thanks for watching. Please subscribe to this channel, the AutPlay Therapy channel, and check out our website, autplaytherapy.com, for more info, articles, trainings, books, all kinds of stuff. And we'll see you next time. Thanks.